This is about a half hour later, and I'll show you the rotation of the hip. And she goes almost to 60 with a softer end feel. And we achieved that with 5 minutes of sustained pressure on all of her hip rotators. I used the foam placed underneath the trochanter, midpoint at the trochanters, and we did that for 5 minutes. And after that, we treated the shift in the pubic joint by placing the foam horizontally under the ischium on the left side, and did that for 5 minutes. After that, another pattern emerged, and that was a sacral torsion, and the lower part of her sacrum on the left was prominent when she was lying prone. The lower left quadrant was prominent and would not spring, whereas the other three quadrants did spring. And so we treated that by having her lean against the wall against this 2x4 by 8 inch foam, and she simply did very subtle bending backward and forward. So I'll be the client and I'll come against the wall and demonstrate that. So we take the foam and we place it across the middle of the pelvis, which captures the lower sacrum. Feet are as wide as the shoulders, about 4 inches forward from the wall, and then the mantra is nose over toes. So I just bend forward slightly, so my nose are over my toes, then I touch the wall with my shoulders and my head, and you just repeat this 30 times. And that restored normal spring mobility in the sacrum. Now after that, actually one of the first things we did was that I treated the lack of hip extension. I placed foam under the thigh, just below the buttock for 5 minutes. Then I did a stretch with her on her stomach, taking the hip into extension and just leaning into it for a bit. After that, we tested all motions throughout the pelvis, throughout the sacrum, throughout the ilia, ischia, and found normative mobility. And the asymmetry of her pelvis is reduced, but there still is a side-to-side difference. And I conclude that she has a developmental asymmetry of the pelvis, so that I'm not going to achieve symmetry. That's not the goal. The goal for right now is to achieve symmetry of mobility throughout the pelvic structure and normal muscle length. And I think I'll let you comment at this point and tell us how you feel in response to that.
Yeah, well, it's definitely a lot easier to walk. It seems more natural instead of like more restricted. So it's nice. It's getting there. It seems great.
So you said it felt less stiff, is that right?
Yeah, it felt less stiff. So when I walk, it kind of felt like before where you know, weren't so stiff. It's more natural.
And let's have you on your stomach. I should probably demonstrate the spring force going through that ischium. So the lower third of the left ischium, you'll notice when I push, there's movement throughout the whole structure, throughout the lower extremity. I can take up the slack there, and now when I induce motion, I see her leg bounce back and forth. So there's a forward spring and there's a recoil. And then when I let go, there's a final recoil. We also found a left side bent fixation of the coccyx, and we treated that as well. So this is the end of this film, and I thank you very much.